Hi, I'm Marla with Clinical Cannabis Today, and we're here at Patients Out of Time down in Tucson, and I have the pleasure to introduce you to Dr. Bearman. He's one of the doctors down here that's presenting and exhibiting, and I'm going to let him explain to you about what he is doing down here at the conference.
Well, it's a pleasure to be here. When we were talking before this, you said, give a little bit about my background. I've worked at every level of government. I've been done about half my medical career has been doing administrative stuff. But I have been concerned about our drug laws for many, many years because I think that they are used in an effort to marginalize people. They're used to demonize people. I think that greed plays a big role in our substance abuse laws, and they don't make any sense. They're illogical. So I'm here at the conference to try to get doctors to join our organization, the American Academy of Cannabinoid Medicine. And this is an organization that is trying to highlight those doctors who make medicinal cannabis recommendations who are doing it right. And basically doing it right means treating cannabis as you would any other medication. What we would like to do is to marginalize those doctors that are practicing minimalist medicine. I mean, if you have a line going around the block and you can see that line move, that doctor is probably not practicing acceptable medicine. And he's certainly going to have a difficult time defending you in court if, unfortunately, it should come to that. So what we want to do is to make sure that doctors are practicing according to good standards and good ethics. We also, our organization provides people that are expert. I mean, we have the former director of the Illinois Department of Mental Health. We have a former member of the first drug czar's office, which was the only one that was really any good. He worked under Jerome Jaffe, who was very qualified. He had done methadone maintenance. He wrote the chapter in Goodman and Gilman, the standard medical textbook of pharmacology. And I'm on there, and as I say, I worked at, for the United States Public Health Service at San Diego State University. I was a director of a county health department, and now I'm doing pain management and making recommendations for cannabinoid medicines, and that's been going on for about 12 years.
How many doctors do you have in your program right now?
Well, right now we have about 50 doctors who are members, and we have another 50 or 60 people that are on our mailing list. I mean, we are a growing organization. I mean, part of the problem when you try to start such an organization as this is you need money, and it's a chicken and egg kind of thing. But this conference has been terrific. I just came from a meeting that we had with several of the doctors here. We had 21 doctors there, and I think it's important for people like yourself and people in the mainstream media, when they're talking about medical cannabis, to talk to doctors. I mean, I have a great deal of respect for other people that are involved in drug policy reform, but when we're talking about medical cannabis, at least some of the time, let's talk to the doctors.
Right, and so it's not a state law that a doctor who is writing a recommendation has to be involved with a group like yours or any other group out there?
No, it's not, and we'd like to see it be that way. For instance, in the state of California, you have to have 12 hours of continuing medical education on pain management and end-of-life care in order to have a license. In order to prescribe Suboxone anywhere, you need to have 8 hours of education. I don't think it's asking too much for the state of California or the state of New Mexico or Arizona to say, take 8 hours of continuing medical education on cannabinoid medicine, and then you can go ahead and write recommendations. Of course, I also think that many of the problems that people find with the current system or non-system, if you will, is that cannabis, when it's used as medicine, should be a scheduled drug. And it should probably be a Schedule 5, but I'd settle for a Schedule 2 right now, and I think we would see a dramatic change. I'm very concerned and very disappointed in Barack Obama's take on drug policy reform. He is not acting the way that he campaigned, and he is not following the science as he said he would, and he's not respecting state laws as he said he was. And that's a great disappointment because I think Obama has shown a lot of courage in other areas, but for some reason in this area, he has the courage of a mouse.
Now, the 21 doctors that you had in your meeting earlier, are they all going to be joining your group, or were they just here to gather information?
Well, if you go and talk to them and twist their arm, I'm sure they'll join.
Okay, there we go.
Many of them are going to be taking our certifying exam, which we're holding tomorrow. We had a test training on Thursday, and we had 11 physicians that took that, and I think we're probably going to have those 11 plus a few more that will take our certifying exam. We're going to increase our profile by being in magazines. Maybe I'll write an article for your magazine about our organization, and by going to conferences like this, but also other conferences like the American Society of Pain Management, or maybe going to the Multiple Sclerosis Society. I mean, people have heard about this, but they need to hear from colleagues. They need to hear from medical people about the patients that we have, and that this really works, and that there's an incredible amount of scientific information that supports the medical use of cannabis.
Right, and if it would come from the state level, it sure would help the cause, wouldn't it?
Yeah, I think the states are making an effort here. Look, let's face it, the government's position is unconstitutional. Unfortunately, only 3 justices in the Gonzalez versus Raich case, and those were Sandra Day O'Connor, Clarence Thomas, and William Rehnquist, recognized that when you're talking about this, the federal government has no role in the regulation of medicine, and that the Ninth Amendment, the 10th Amendment, a 1942 case called, or a 1925 case called the Linder decision, all recognize that it's the states that regulate the practice of medicine. What the federal government has done is made this bogus claim that somehow if you are growing your own medicinal cannabis in your backyard and using it in your living room, that has an effect on interstate commerce. And that kind of logic is what is making people disappointed with our elected leaders, because they're trying to get us to accept nonsense rather than take a look at things from a common sense, practical, reasonable point of view.
So now how can the viewers or the doctors get a hold of you, and how much is the program? How much is it to take the test?
Okay, well, our organization is called the American Academy of Cannabinoid Medicine, so you can just Google us, and our website is www.aacmsite.org, aacmsite.org. The membership varies. If you're a healthcare professional, if you're a physician, it's $150. If you are a student, it's $50. And if you want to be a supporter, we'll pretty much accept any amount of money, from $1.50 to $4,000.
Okay, and we take credit cards, right?
Actually, we're going to have to use somebody else's credit card machine, but we use PayPal online.
Okay, all right. Okay, great. Yeah. Well, thank you so much for taking the time to be interviewed today, and thanks for watching.